So now that I've shared the 10 principles of strategic case making, let me just say a few words about just some of the considerations you want to have in mind as you're thinking about your own sort of journey of case making. One is, before you start to make this sort of very strong strategic case that you have to your audiences, is you want to make sure that you put the big rocks in first. I talk a lot about this in my book, Strategic Case Making, the Field Guide, because it really is important that before you start, you're starting on a solid foundation. So let me talk about some of the things that should be in that foundation. Number one, trust. You got to be asking yourself, do I have the trust of the people that I'm talking to? If the folks that you're talking to don't trust you, there's not a relationship there. I don't care how strong your case is. I don't care how intentional you are about building that case. If they don't trust you, they're not going to lean forward. So before you do that, I want you to be thinking about, what have I done to build the relationship of trust with the group of folks that I'm talking to? And if I need to reinforce that, right, then let me do that. And in the book, I talk about some of the ways in which you might be able to do that. Let me give an example of some of that, just one example potentially, of why that trust building work is so important and some of the things you can do from a strategic case making point, even as you engage folks, to start to build that relationship. I was working with a set of doctors in Pittsburgh, and they were putting together a series of programs that were going to address maternity issues and some mortality issues. The fact that lots of moms, particularly women of color, were dying at higher rates in childbirth than other women. And they had designed this series of workshops that they were going to share with moms, right? Incoming moms, as they were getting ready for childbirth. And they designed these workshops, and they came to me and said, we went out the first couple of times. They didn't go so well. We pretty much got tomatoes thrown at us, and we were just trying to help. It's backfiring on us. And so I watched a couple of their sessions, and we came back. I said, listen, you're talking to folks who don't trust you. So before you get into your case making, you got to do something that helps folks to trust you. So when you get those tomatoes thrown at you, stop the presentation, wherever you are, and build the trust. And we worked out a few kind of opportunities for them to do that. And so next meeting we went to, and this was their first maiden voyage, kind of using their technique. So they went to the meeting, and what's really interesting, so we're in the room. He starts to give the presentation about all the things you got to do as a mom to make sure that you have a healthy pregnancy and you deliver well. And one of the moms in the room, and I will say the dynamics of this was, the doctor was white. Most of the women in the room were women of color. And one woman sort of raised her hand and she said, listen, before you start talking about all this, when I go to that hospital, they don't treat me respectfully. They don't treat me with respect. And I know many people have gone to that hospital and they haven't been treated fairly either. And I can tell you all the ways in which that hospital, you go in there, and she started going through a litany of things that had happened that had gone wrong already, even in her experience with the hospital. And so he responded. He, did what I asked him to do. He put down, the papers that he had in front of him. And he said, I get that. And he said, I can't solve all of that, but I'm going to listen to you, and I want to know all of the things, that is not going well in this journey so far, because I want to make sure the folks who are in our hospital understand that and are working to resolve that. And he said, I'm here talking to you because I believe that your baby is the most important baby in the world. And I want to make sure that you get treated like that. And if I need to stop and make sure that we have that conversation, let's do that now. That's an example of getting off course, You're not trying to make a case for that first. Your first responsibility is the trust building work that has to get done. And legitimately, his role was to be, to share some information that could really be powerful in the lives of these women, but they were not going to even hear that conversation because there were a series of other things that already happened and a trust relationship that had been broken. What I will tell you today is that program, which started out as a very small program, kind of working with moms across the state, is now one of the largest programs across the state of Pennsylvania that works with moms, especially moms of color, who are coming into hospitals and needing some of that additional conversation. And one of the things that's happened as a result of that has been the investment in all kinds of what we might call non-traditional opportunities or interventions, things like having more investment in doulas, things like having more investment in early, care for moms who may be particularly at risk. But I want to say that early on trust building work was so critical. That doctor could have talked for hours and hours, and women would have never even heard what he said because they didn't trust the information. They didn't trust the information that was coming forward. So let me also share, just in terms of the case made, some of the things that we think about in terms of our work. I will say to you that we only take clients who are doing the tough stuff, right? The stuff that is about systems change, right? The stuff that is about folks who are really trying to lift up how institutions function differently together, how organizations work together, those sort of big, thorny, adaptive problems that we've talked about as we were talking about the principles. Those kinds of issues are so much harder for all the reasons we just talked about. And it's important for us to make sure that we are getting to the tough stuff in terms of some of the work we do nationally. The tough stuff are some of the issues of equity, the organizations who have an equity lens and are trying to lift up what it means to meet the needs of those who need it the most, because those institutions are not serving their needs very well. And the consequences of not meeting their needs are dire. So when we look at organizations in terms of why we would work with somebody having a strong equity lens, or at least the inclination that equity is a central both process and outcome of what they're looking for, is critically important. The last thing I would say is inclusion. It is really important that folks really come at this from the vantage point of radical inclusion. That is to say, thinking completely outside of the box of who needs to be at the table. Someone once said, certainly, if you're not at the table, then it's likely that you're going to be on the table, right? And so our notion is nobody should ever be on the table, that people need to be at the table and in the conversation. And so when we work with groups across the country, one of the things we ask is, who else needs to be at this table? Who's missing from this table? We want to be radically inclusive. So who's not at the table? Where's the invitation that allows us to bring new folks to the table and to be very intentional about that, right? If you're looking around the table and there's no new faces, there are no new groups or no new sectors, then I will say then you're not looking hard enough, because so many people need to be in the conversation that it's important that we're extending those opportunities and those invitations. Having said that, it is harder to manage wider groups, which is a part of why this sort of approach around strategic case making is even more important. So I just want to reinforce that at the beginning of your case making journey has to be an understanding of, am I talking to folks who trust me? And if I am, then I've got the foundation of what I need to move forward. If I don't, stop. Put the PowerPoint aside, put the notes aside, and do the work to build the relationship that allows you to make the case that you need.